Professor Cohen, I am going to do my presentation on the LifePak 12 monitor. We use it every day in fire rescue. It's capable of doing all sorts of vital sign monitoring on switch, first of all. And this machine can take blood pressures. On my esteemed colleague German here, who happily volunteered. Now, blood pressure, heart rate, all I have to do is slap this right on his finger and it'll give me the O2 saturation and heart rate displayed here in the top left-hand corner. There you go, as soon as it starts to read there. Now I'm going to demonstrate proper placement of 4-lead EKG, which is the basic picture of the heart that we do to all patients just to get a standard for where we're at. Now they're pretty self-explanatory, LL and RL for left and right apex, which could be the leg or the lower torso. Now what these do, sends positive and negative electric currents back and forth at tape. Right and left. Shut up. What these do is sends positive and negative currents back and forth to take pictures of different sides of the heart. Like I said, it's just a baseline. If you see, we'll have the P wave and the QRS complex and the T wave. Now to take a more advanced picture, we add 6 more leads, which would make it a 12-lead EKG, and I'll demonstrate proper placement of those as well. These are identified by V1 through V6 in colors. V1 being red, we'll place that between the 2nd, 3rd intercostal space, just to the right of the sternum. V2 will go in the same 2nd, 3rd intercostal space, right on the other side of the sternum here. We'll place V4 mid-clavicular, right under the nipple line. Since that's such an easy identifiable location, we'll add V3 in between V4 and V2. Thank you.
You're welcome.
V6, mid-axillary over here on the side. Close. And V5.
Come on, this is for school, German. Pay attention.
You still got
That's true.
Focus.
That's true.
On the left.
Tommy, once again, thank you for bringing that to my attention.
So now we're ready for our EKG. Get a nice. So we'll hit the 12-lead button here, and then we'll ask the patient's age. German, how old are you? Like 40. And we'll tell the patient to not move or speak and hit the 12-lead button, acquiring 12-lead. One of the couple of the features of this machine is that if we have a patient in cardiac arrest and we need to shock them, we have all our defibrillation settings here with the charge and the joules, energy select.
Can you show us?
I don't want to burn all his hair off. Pacer for bradycardic patients whose heart rate would be under 60 and symptomatic, or cardioversion when they have supraventricular tachycardia over 150 and are also symptomatic, and we need to treat them for that. Another feature would be if we attach a nasal cannula with this orange adapter here, which would plug in right here. It's got a little lip on the end that can measure the amount of CO2 the patient is breathing off, which could give us even a more accurate idea of how they're breathing is besides just the little finger. It's just another respiratory feature. So, wiring 12 lead. Now what this does, instead of just having the 4 leads sending positive, negative deflections in those certain areas, now we have all of them that takes pictures of anywhere from the inferior part of the heart to the anterior lateral part of the heart. Gets a whole 360. It just makes the heart a whole 360 angle, so we can see what's going on at every single angle, see if there's any blocks or anything like that. And we basically use this every single day on every single patient, and that's the LifePak 12. Thank you, Jeremy.
Anytime, Carl.